Hello and welcome to the COVID-19 Vaccine Hesitancy Speaker Series presented by Washington Thoracic Society. I'm Simney Kim from Cairo 7, and as Cairo 7 Cares, we are pleased to sponsor this speaker series. Now, many Americans are still deciding if they will get the COVID-19 vaccine. The American Lung Association is proud to work with our sponsors and partners to provide culturally relevant, science-based, factual guides about COVID-19 vaccination. National vaccination initiatives in the U.S. support the critical work of achieving health equity for all Americans. Along with our presenting sponsor, the Washington Thoracic Society, we're appreciative of the sponsorship support from Pharma and the Fred Hutchinson Cancer Research Center. We also have a few housekeeping items. We'll have an opportunity to take questions at the end of the program. This is very important because we have an amazing speaker here, and so you get to ask everything you want. So what you need to do is you need to use the chat feature at the top of the toolbar to submit questions. This call is also being recorded, and we'll send out recording links after all of our speaker series. Last week, we began this speaker series discussing vaccine hesitancy, laboratory safety, production and distribution, and the role of systemic racism. We were joined by Dr. Stefan Wallace from the Fred Hutch COVID Prevention Network and Courtney Christian from Pharma. Today, we are joined by Dr. Ben Danielson to discuss vaccine hesitancy in the Black and African American communities. A 1992 graduate of UW Medicine, Dr. Danielson went on to complete his residency with Seattle Children's and eventually led the Odessa Brown Children's Clinic. Currently, he practices pediatrics at UW Physicians, and he's a clinical professor at the UW School of Medicine. He continues to develop a new program to advance health equity. His dedication to health equity and public service garnered many honors over the years. In 2018, he was named the Seattle Municipal League Citizen of the Year, and in 2016, he earned the Norm Mailing Advocate for Youth Award. He sits on many nonprofit boards and has served on several mayoral task forces. He was also appointed by Governor Inslee to serve as chair of the Governor's Interagency Council on Health Disparities. So at this moment, I would like to welcome Dr. Danielson to this discussion. Dr. Danielson, thank you so much for being with us today.
Thank you.
Now, Black and African. Oh, yes.
I'm honored to be here, and I'm embarrassed by the very nerdy picture that always shows up when I'm a part of these events. But thank you for this invitation.
This is incredible. I was really excited to be here. I'm kind of like fangirling right now because I knew that you were going to be the speaker, and I don't think you look nerdy at all. But anyway, Black and African Americans across the U.S. have deepened our country's legacy of ingenuity, creativity, and endurance. Yet social justice like wealth gaps and health disparities continue to stifle the ability to secure legacies for their families. Despite social and economic injustice, this community continues to stand up for their personal well-being and that of the next generation. Now, understandably, this is really complex. You cannot boil over a century of data into one answer. So, Dr. Danielson, can you just start us off with a little background of the history of vaccine in the Black and African American community?
That's a wonderful question, and it is hard to boil that down into just a few comments. But I will say that we all continue to learn important lessons about the way health was promoted in different cultures across different times. And as we look into and understand the history of vaccinations, we trace a lot of those actually back to the African continent and lessons learned about inoculation that have come from practices that go back many centuries in that space. So Blacks, Africans, Americans hold their own strong history in the development and promotion of vaccines in different ways. In this country, there's also been a troubled history, of course, with healthcare in general, a history that goes on today, that continues to affect Black communities across the country and affects the lives of people in communities that we care about. So it's important to know that the stories, the experiences, the negative and hard experiences that BIPOC and Black communities especially have had with the healthcare system go back a long time, but also continue today. Therefore, the concerns, the questions, the ways in which I think Black communities want to understand things better is based on wisdom. It's based on well-earned lived experience, and honoring that, honoring the idea that each of us has the right to understand more, to ask questions, to stand up for our communities is an important component of this conversation. So thank you for letting me sort of open with that kind of a soapbox stand.
Well, understandably, there is a lot of historical mistrust based on what you're saying. So can you go into those, some specific examples? I know that we've heard about the Tuskegee experiment, smallpox inoculation. Let's just get a little background about what exactly happened in those and what led to this ongoing state of historic mistrust.
Well, it's not so far back in the rearview mirror to look at the Tuskegee experiments because they span such a long period of time. The use of Black bodies as experimental vessels without their informed consent or knowledge, the isolation of them actually from care, Black people who suffered an illness, syphilis, that was actually became very treatable over the course of these experiments that occurred in the Tuskegee injustice. Those were really painful acts because it showed you how Black people were just demeaned and devalued, were not considered worthy of their own voice, their own agency, their own consent in being part of experimental treatments. They were lied to and told that they were getting extra care, special care for their condition. But the true intent of that research was to allow a disease to fully run its course, which means destroying your body, destroying your brain, affecting your ability to have normal daily functions, really causing you to die from the inside, and watching that happen over time without treatment, without really knowing that that's what's going on for you, without the best possible support, even as others with syphilis were afforded the kinds of antibiotics and other treatments that were becoming more and more known to be effective. It's one of our worst injustices, and it's only emblematic of the many other ways in which healthcare has bypassed the rights of certain communities when it came to informed consent, when it came to really being potentially part of the benefit of care, and has subjected Black and Brown communities to the worst parts of healthcare when it comes to disproportionate outcomes and difficult experiences. And it's worth pointing out that we know that even today, from an illness perspective, that the coronavirus pandemic has had a disproportionate, a heavier impact on Black and Brown communities than other communities. And so in a way, it feels so much like you pay the heaviest price in every direction, from not finding a healthcare system trustworthy, to having the worst possible outcomes from an illness, to not having the economic and resource support as much as other communities to be able to sort of shelter and weather the storm of this pandemic, to then even sometimes not having access to the best possible treatment, which I would include the coronavirus vaccines in that category.
It is extremely troubling when you break down these different things that have happened over time and the ongoing structural racism facing some of the BIPOC communities. Yet here you are, Dr. Danielson, you use vaccines in your practice. Why do you use them after all of this, and why do you recommend them?
I'm a pediatrician, a general pediatrician, and I worked for 21 years in an amazing clinic called the Odessa Brown Clinic, which served mostly Black and Brown young kids in Black and Brown families, mostly low income and full of spirit and strength and incredible wisdom and brilliance. And it was important for me to make sure that the families that I had the privilege, the honor to work with, had access to the best possible care in every possible way. That can mean just the quality of the experience of care, making sure that when they walk through a door, people look like them, people understand them, see them, and that they feel seen and recognized. Also transfers into the best possible technology and technological care. When it comes to testing and trials to see which treatments are best, there are probably no other parts of our healthcare system more subjected to careful trials than the vaccines that are recommended in general. As a pediatrician, boy, we have to offer a lot of vaccines. Kids get lots of pokes in those first couple of years, especially, and it's not fun. It's not fun for the kids. It's hard sometimes for a parent to watch that happen. But I absolutely know, among all of the things that occur in medicine, all the things that we offer in Western medicine and healthcare, the vaccinations are actually the best tested, the best proven, and the most effective at making sure not only individuals in communities, but communities themselves stay healthy. That not only kids get protected from the kinds of infections that can alter their lives, but that their elders get protected from those same infections from kids bringing them to other spaces. That not only do healthy kids get protected from infections, but that kids with complex healthcare needs, which are often kids of color, get protected from what could be a devastating infection for them when it might be a milder infection for someone else. So with all of that in mind, knowing that these are the most tested and proven approaches to treatment, knowing that they help encourage our own immune systems to do what they do best, knowing that the communities that we serve deserve the very best treatment, the very best possible opportunity for treatment, the very best climate and culture of treatment, all of those things have reaffirmed for me the value of vaccines and the appropriate value of well-trialed and tested vaccines. I'm sorry for that rant, but I feel very passionately about that particular issue.
And we appreciate your passion as a mom of 3 who has cried tears through every one of her baby's pokes and jabs.
Yeah.
It's a comfort to hear you talk about the safety and the efficacy of these vaccines. So now I want to talk a little bit more about how exactly vaccines work and how specifically the COVID-19 vaccine works.
Vaccines can work in a lot of different ways. The furthest back history of vaccines, I think, was often related to just taking a very small amount of something that might cause illness, and because it's a small amount, your body has a chance to mount defense to it. Or taking a slightly different version of something that might cause illness, but because it's closely related to that illness, your body can mount a defense against it. That history goes back to Africa, and it goes back to Europe as well. So there are deep roots in that kind of inoculation with something in order to stimulate your immune system to fight it. Over time, there have been many other kinds of vaccines developed. Over time, there's been the idea that maybe it's just a few of the elements on the surface of a virus that need to be presented to your immune system in order for your immune system to work well. And so a lot of our virus vaccines that kids get, especially pneumococcal vaccine and H-flu vaccines and all those others, they're based on just taking a small bit of a virus or a bacteria and showing it to your immune system so that your immune system will recognize it and fight it off right away. There have also been new advances in vaccines, especially during this COVID pandemic. And I know you've had Dr. Wallace and others speak to you, so I'm sure everyone knows this as well or better than many of other folks do now. But the great innovation in 2 of the major vaccines against coronavirus, COVID-19, have been the development of messenger RNA or mRNA vaccines. And so rather than expose you to any part of the virus itself, this really clever approach just takes the messenger, the UPS deliverer, the mail person that would deliver information about an infection and use it to deliver that information directly to your immune cells and allow your immune cells to develop their response, their protection, their ability to fight off that virus without actually ever having to be exposed to that virus. That's a pretty cool idea. And I know that for many, many years, decades, researchers have been really working with these messenger RNAs and really seeking different ways to help them help us. And the need for innovation, the strong thinking, the presence of brilliant people working on these vaccines in this past year have yielded us this creative and innovative approach to safely getting us protected against a virus that can do a lot of harm. There's another type of vaccine also that uses sort of another approach. It takes a mild virus, not coronavirus, but a very mild virus that doesn't really hurt your body, and uses it as a delivery system to bring messages to your immune system as well. That one is the Johnson & Johnson vaccine. The mRNA, the messenger RNA vaccines, are the Moderna and the Pfizer vaccines.
It is quite remarkable the work that scientists have been able to do in order to get us these vaccines in a record amount of time. The U.S. joined an international community of the COVID-19 warp speed vaccine creation. And I think it's that warp speed part that confuses and concerns a lot of people. Talk to us more about this process of creating the vaccines, how you can assure their safety, and how they were able to get out to the market in such a short amount of time.
I think your point is really important, that so often our own language gets in our own way when we try to do good things, that we create convenient language, what we think is peppy language, or medicine, we create weird Latin, Greek kind of language in order to help describe things, but all it does sometimes is separate people from that information in a way that just makes you more uncomfortable. That idea of warp speed sounds exactly like you're doing something faster than physically known before, and that understandably creates a whole lot of important questions about how exactly do you get to warp speed when we know that that's not something that exists except on Star Trek these days. But what is true about that process is just that the need for us to get to a vaccine across this globe, to get to a set of vaccines and opportunities to be protected, was sparked by just the rapid spread, the deadliness, the incredible threat, the shut down the world potential of this virus over a year ago now, and the need for us to respond as a globe, with our smartest scientists coming together and not only figuring out how to do something important, but how to do it with pace, but still with safety, became an incredible priority, an incredible journey. Things were done that helped to make the process of bringing a vaccine through the trial process happen faster. The steps that used to be spread apart by chunks of time were done side by side or even right next to each other in order to speed up the process. And they were done in a way so that speeding that up did not compromise the safety of the process at all. The work of many different laboratories, many different scientists, combining their knowledge, sharing knowledge, maybe in a way that we didn't used to share